So earlier in the show, we talked about the components that I felt that we have the most control over in terms of hips and knees, and that is joint flexibility and mobility. And we said that mobility in a joint allows us to move. Then we went on to strength and stability, and we said stability makes us move efficiently. And when you have a total joint replacement, the one thing that you want to make sure is that everything else around that joint that's driving that joint for the next 10 to 15 years is in really good working condition. So the surgeons took care of the replacement parts, took away your pain, but now we have to take care of all the things that are going to improve your joint integrity and help you function longer in life. This is why we've come up with the Total Joint Champions program at Function Better. You see, we don't wait until someone has the surgery to intervene. During phase 1, we identify restrictions in your joint, deficiencies in your muscle strength, lack of stability, decreases in functional performance. We look at your body weight, your body mass index, your body fat percentage, and we intervene with nutritional strategies and exercise strategies to decrease your body weight. All of these things together will help preserve your joint after the surgery. If you're scheduled to have a total hip replacement or a total knee replacement, you better get serious about it right now, because going into a surgical procedure with muscle imbalances, capsular tightness, joint stiffness, weakness, lack of stability, and being excessively overweight are all factors that are going to slow down your recovery afterwards. So get with a professional. Specifically, enroll in our Total Joint Champions program and get a 4 to 6 week head start on your recovery even before the surgery takes place. We talked to you about what you can expect in the hospital in terms of care and post-surgical days in the hospital. While we don't make the decision whether you go from the hospital to your home or a subacute rehab, we can educate you as to some of the things that the surgeon is looking for to make that decision. We talk to you about home preparation, things that you should do now in the home to prepare for the implications after surgery. We talk to you extensively about deep vein thrombosis, avoiding blood clots following surgery, as that is a risk of all total joint replacements. Following our assessment and our educational component of phase 1 of the Total Joint Champions program, we go on to discuss with you your goals and our goals for you, and we devise a treatment plan that you carry out independently under the supervision of a licensed physical therapist on site. After you go in for the surgical procedure, you'll go through some things before we encounter each other again. When you come back, we're already 4 to 6 weeks familiarized with you, your condition, and any obstacles that you had in terms of your recovery. So now you start outpatient physical therapy. Outpatient physical therapy begins again with another assessment. Now that you've had a surgical procedure, things can change and you need to be assessed again. And we also come up with a treatment plan, set goals, and for your rehabilitation, probably between a 3 to 6 week period you have outpatient rehabilitation. Towards the end of your physical therapy, and after several examinations and assessments in terms of how you're functioning, how you're climbing stairs, how stable your joints are, how independent you can become, we move you on then to phase 3, which is an independent program but designed and directed by your physical therapy staff. The exercises and activities that you will participate in phase 3 will all add up to more flexibility in your joint, better mobility, more strength, better stability of muscles surrounding the joint that you had replaced as well, decreasing your body weight, nutritional strategies, and other activities that will give your new total joint replacement the longevity that you're looking for. So if you're already scheduled for a total knee replacement or a total hip replacement, give us a call to enroll in our Total Joint Champions program so that you can function better following your surgical procedure. And if you haven't even considered a total knee replacement or a total hip replacement, but you're experiencing knee pain and hip pain right now, give us a call. We always do complimentary consults, and the prognosis is much better when you catch a condition early. I'm Joe Martin, and I'm your physical therapist. I'll see you next time on Function Better TV.